Thanks, Rupesh. Hello, welcome everyone. I'm Saloni Khatri, along with Dr. Vikas Jain. I am one of the program directors for this youth initiative, and we welcome you all. A couple of housekeeping rules before we begin. If everybody can keep their audios muted, and if you want to turn your cameras on, we would love to see all of you. And if you want to watch it in the speaker view, it will be, it's up to you, but it basically avoids distractions. And then there'll be a Q&A session in the end. So we'll have 5 minutes at the end of each program so that you can ask any questions that you have. So our first speaker is Dr. Ankur Gupta, and it's my pleasure to introduce him. Dr. Gupta graduated from University of Michigan School of Dentistry in 2004. He did 1-year general practice residency at Metro Health Hospital in downtown Cleveland. And after finishing the residency, he and his wife, who's sitting right next to him, if you see it in the camera, after finishing residency, both of them, they started a private practice in North Ridgeville, Ohio. It has been open for past 15 years. Along with being a general dentist, he also is a visiting instructor at Case Western Reserve University, Ohio State University, University of Pittsburgh, and University of Michigan. I have known Dr. Gupta for many years. For those who know him, will agree that he is a great speaker. He has a lot of energy and enthusiasm and always has great ideas. He has worked with youth for past few years as he teaches self-development classes too. His classes are fun and engaging, and I will vouch for that since both my children have been his students and they love him. So we are fortunate to have him speak today on Path of Dentistry. Here you go, Dr. Gupta. Thank you.
Okay, hi everyone. And thank you, Saloni. Thank you, Rupesh. Thank you, Vikas, for having us. Between the two of us, myself and my wife, I enjoy public speaking a little bit more. And so I'll be doing most of the speaking, but you'll notice in a lot of the photographs that there is another lady that looks like I might be married to her. And so I want to make sure that that you can put a name to a face. And so this is my wife, Dr. Nisha. I'm Dr. Gupta.
Hi.
And this is actually her teeth.
No,
I'm just kidding. So here's the big question. A lot of people wonder about dentistry because most of you have really nice teeth. And when you go to the dentist walks in and says, "Hey, Timmy, how are you doing? How's the old baseball team?" And then you make some small talk for 5 seconds. And then the dentist walks away. And you think to yourself, what the heck does the dentist actually do? And the fact is, for you, probably for most of your life, the dentist isn't going to do much. But there's actually a lot that a dentist does. And I want to make sure that you all finish up with this lecture knowing what is it that a dentist does. To start off, though, most of you who are watching are probably in high school, you're young adults. And you're probably wondering, what are the educational requirements to get into dental school? So let me break it down, but I'll add a couple nuances that are a little bit unique to dentistry. So you have to finish high school, graduate. Hopefully you all will do that. And then you have to go to 4 years of college and get your bachelor's degree. A lot of people call that your undergraduate degree, okay? And when in college, the average GPA for the average dentist, the average dental school student, is a 3.55. So that's not your high school GPA. That's the GPA that you have while you're in your 4 years of undergraduate college. You can take any major you want as long as you take certain pre-dental requirements. So we had students in our dental school class who were engineering majors, accounting majors, we had social work majors, we had all of those types of majors. And the majority, of course, were biology and biochemistry majors, but it didn't really matter. As long as people took the pre-dental classes, they could have majored in anything. And then before applying to dental school, I'm sure a lot of you have heard of the MCAT, right? Most of you have probably heard of the MCAT. In dental school, to get into dental school, we take a similar but different exam called the DAT, the Dental Admissions Test. And I'll talk to you about that in just a moment. Then you get into dental school, and dental school is 4 years, okay? So 4 years of college after high school, then 4 years of dental school, and when you finish, you're an actual DDS or a DMD. You can actually put those little letters after your name. But very few people immediately after dental school start their private practice. Some people do a 1-year residency like we did because we're both general dentists. So we did a 1-year general practice residency and it was optional. Some people can go straight to the workforce, but we decided not to. We wanted to get another year of training. And then there's dental specialties. Most of you have heard of an orthodontist. Those are the dentists who put braces on. Those people are required to do a 3-year residency after dental school. So think about that. 4 years of college, 4 years of dental school, and then 3 years of residency before you start working. A pediatric dentist does a 2-year residency. An oral surgeon does either a 4-year residency or a 5-year residency, depending on whether or not they want to add an MD to their name. So some oral surgeons who take the amount of training necessary, they end up becoming DDS, MDs, okay? So I think a lot of you are kind of wondering, like, all right, what's the difference between the DAT and the MCAT? And they're actually quite similar. In the DAT, you have to be knowledgeable with your biology, with chemistry, organic chemistry. You do some stuff with math, with reading comprehension. But then there's an extra element to the DAT, and that's called perceptual ability. So were you any good at perceptual ability?
I had to practice a lot.
I wasn't either. Both of us were terrible at it. But let's give you an example of what perceptual ability is. So let's see, Saloni or Dr. Khatri, go ahead and unmute yourself. So for question 1, I want you to look at that design that's on the left. That's the one with the white border, and it kind of looks like a church, right? That design. Now you can turn that design anywhere, any way you want in your head, but I want you to pick which of the keyholes, A, B, C, D, or E, which of the keyholes would allow that particular design to fit directly through without any space in between. What's your guess?
I would go with the A.
Okay, so actually A is wrong. And I don't have time today to explain why, but it's actually C. And for some of you, you're like, what? That's C? How the heck is it C? I don't see that at all. And that means that you're maybe perceptual ability challenged. And some of you will be like, oh yeah, I can kind of see that. You just turn it a little bit this way. Oh yeah, okay, I can see that. And that means that you have a little bit of a greater strength with perceptual ability. Either way, that's not a deal breaker to get into dental school. I don't think I was that good at it. I don't think I was a natural, nor was Dr. Nisha. But you know, over time, you start to develop a little bit of that part of your brain strengthens. But this is something that you're required to perform well in order to get into dental school. Okay, so now you're a dentist. You made it. Way to go. You finished your dental school, you finished your residency, and now you're like, ah, sweet, I can work. And we're going to talk about what's good about being a dentist, what's bad about being a dentist, but we need to make something clear. The two of us, after we finished residency, we immediately started our own practice. We found a space that was for lease in North Ridgeville, and we just renovated that space. We borrowed a ton of money from a bank, renovated that space, bought some dental equipment, and put it in there. And so that makes us private practice owners. We're owners of a private practice. And so everything that I'm going to talk about for the rest of this lecture is going to be from the perspective of a private practice owner. Sure, we know a little bit about all these other categories, but what we know best is what life is like as a private practice owner. So let me real quickly give you an idea of what all the other things are. An employee for a private practice would be like a younger dentist that the two of us would hire to work in our office, you know, to help take some of our patient load and work some of our hours. But they're still an employee. We're still the boss, they're still the employee, but they get to work in our practice. That's an employee in a private practice. Another one is employee for a large corporate entity. I'm sure all of you have heard of like Aspen Dental, or what's another big one? Dental Works. You might have seen them. They're just they're usually in shopping centers and they're all over the place. They have a big marketing budget. Those are large corporate entities. Those are places where most of the dentists that work there are employees. There are a few dental owners, but most of the dentists are employees. You could be an employee for a large clinic, like a large government-run clinic. So let's talk about those. you know, the Department of Health and Human Services, which is a federal government entity, they have put different large clinics throughout usually poorer neighborhoods throughout the country, where there is a need for healthcare employees, healthcare workers, to treat people who don't have regular access to care, maybe because of insurance limitations or financial limitations. And so you could be a dentist working for one of these large clinics. Also, the government provides dental services to prisoners. The government provides dental services to Native Americans on their reservations through the Indian Health Service. And then, of course, a big one is providing dentistry while in the military. Almost any time that there's a military unit, they need a dentist on staff. So if somebody gets a toothache, breaks a tooth, something like that, they have that healthcare available to them. These are all government entities. And even though there's a lot of pros and cons with all of these, we can't really talk much about them because we're not employees of the government. We are private practice owners. The last one is an educator. And that's a dentist who works for maybe a dental school, who spends the majority of their work week at a dental school educating young dentists how to develop the skills and the technique to be successful dentists, okay? So again, we're gonna talk from the perspective of private practice ownership, okay? So what's good about being a dentist? And I think the two of us would agree that one of the coolest things about being dentists is you get to do a little bit of everything. I know that most of you have gotten the experience, if you've had a cavity, you've had a dentist fill it. Okay, cool, a dentist stuck a needle in your mouth, drilled something, you felt some water flying around, and then the dentist said, okay, good job, you're all done. That's a cavity filling, right? But we get to do a lot of cool stuff. For example, we have a laser in our office, and here I'm doing a root canal in which I'm eradicating all the bacteria that's in the root of a person's tooth using a diode laser. Now, I don't know what makes that cool, but I kind of feel like I'm in Star Wars and I have like a little mini lightsaber and I'm jamming it up the patient's tooth to kill all that bacteria. It's a cool feeling to do something like that. Another thing we get to do is patients who have different degrees of sleep apnea because their mouth isn't shaped to house their tongue. We get to orthodontically treat their mouth so that we expand their palate and give their tongue enough room. Now, if you see here, this lady, she's going to be breathing better as a result of our treatment, but also she looks better too. That's something that dentists get to do. In this case here, a patient was missing a few teeth, and we had the opportunity to surgically place a few titanium implants, titanium screws, into her bone and build new teeth out of that bone. And the patient is really thankful because these things feel like teeth, only we know the secret that they're actually made out of titanium. That's something that dentists get to do. This picture over here, what this is a time in which we were able to take stem cells from a person's arm. We basically stuck a needle in their arm, took the blood, put it into a couple vials, and we were able to throw those vials into a centrifuge and isolate and collect the platelet-rich fibrin, the platelet-rich plasma, and use that to create a bone graft so that if a patient has a defect in their mouth, we can actually close up that defect with their own stem cells. That's a cool feeling. It's, I think that for the two of us, we've been practicing for so long, nearly 2 decades, it gets kind of boring sometimes to just do fillings. And it's really cool that being dentists, we get this extremely diverse set of abilities to treat people. And then of course, the obvious one, sometimes we get patients that come into our office looking like this, and we get to see them for a couple appointments and they get to leave looking like this. This is an incredibly emotional experience for certain people who've been self-conscious about their teeth their whole life. Those things are good. Let me give you some other good things about being a dentist. Now, this is from our perspective as private practice owners. You get to be a business owner, and that's a major thing. Getting to be a business owner means you get to pick your team. If somebody is somebody who doesn't fit within your vision of how people should interact with each other, you can let them go. And you get to decide who are the people you bring in so that you have the happiest, most efficient type of workforce. That's not always available. Most physicians, most lawyers don't have that type of autonomy. But when you get to be a small business entrepreneur, you get to pick your team. Moreover, you get to pick your philanthropy. You know, for us, our big philanthropy, our biggest one, is that we provide free dental care to military veterans every year on Veterans Day. So we have a little Veterans Day event where we have literally hundreds of veterans come to our office, and we just do a bunch of free dental work on them. Now, we don't have to like get permission for this. It's our office. It's our office. We're in control. If we want to give a bunch of dentistry away for free, we can do that. No permission, no boss, no human resources, nothing like that. We just get to go in and do our work and feel good about ourselves because of that philanthropy. Another thing, you get to pick the way that your office looks. If you want some sconce lighting, if you want a wall painted purple, if you want that little stone, what would you call that even? That stone wall, that brick wall thing that's behind me and Nisha, you get to pick that kind of stuff. If it's within your budget, if it's not going to stress you out financially, it's something that you get to do, because being an entrepreneur is pretty awesome. And you get to pick when you work. Most dentists who own their own practice work 3.5 to 4 days a week. And that's a great feeling. Our income is in the higher percentile of most professionals, yet we don't work 5 days a week. Now in our office, because we're a husband and wife team, I work 3 days a week and she works 2.5 days a week. This gives us the opportunity to do more philanthropy. It gives us the opportunity to teach, and it gives us the opportunity to spend time with our kids. And that's something that's not available for most professions. You get to pick the procedures, which we talked about a second ago, and you have control. And one thing about dentistry, which is pretty cool, is because you're not really dealing with life, and I mean, sometimes you are. Sometimes you're dealing with like, you know, really important, really big time, hardcore stuff. But a lot of times you're dealing with just teeth. And the cool thing about that is if you're a fun person, if you're an easygoing person, and you want to make your office a fun, easygoing, goofy, high sense of humor type of environment, it's all you. You have the control to make your office as fun as possible. And what we have found over the 15 years that we've had our practice is that our team has become our family, because we not only work together, but it's very important for us to do as much as we can to make it fun and invigorating and make them want to come to work. And that's a really great feeling. When you're the entrepreneur, you get to do this kind of stuff. And that's a really good thing about being a dentist. All right, now I've gotten you hooked. Let's talk about the bad stuff. All right, the bad. Ready? It's gross. It's just gross. Some people have totally stinky breath. I remember I took out a denture on someone, and this dude hadn't taken out his denture in like a year. Can you imagine how much built up food had probably gotten caked underneath that denture? I took that thing out and the whole office smelled. It's gross sometimes. And that's just how it is. You look at those teeth on the picture there and you're like, oh, well, you know, Dr. Nisha, Dr. Gupta, they've been dentists for 17 years. They should know how to fix that. No, we're still kind of looking at that and being like, dude, I don't know what to do. That's just gross. And that's going to be technically difficult to fix. Wouldn't you agree? That's just hard. And see, that's the thing about dentistry is like, yes, you learn the skills, you develop the skills. Over time, you get that muscle memory and you get good at using a drill and using your hands. But some things are just very technically difficult. Some people have chubby cheeks. Some people have lots of saliva. Some people are just difficult to work on. And it really doesn't matter how long you practice. Certain things will always be difficult. And that can be a pain in the butt. I want to talk briefly about debt. Now, I know some of you may not have to deal with this. If you're in a situation where your parents might be able to help you be educated, etc., that's a wonderful thing. But if you're like most people, if you're like us, you're going to have to borrow some money in order to be educated. We're talking about 8 years of college. And sometimes you have to borrow money to get all of that training. Student loan debt for dentists is higher than any other profession. It's the highest. Dentistry is the most expensive of all the professional schools. And so if you don't have family help, you're going to graduate with a lot of student loan debt. Then when it's time for you to say, okay, I want to become an entrepreneur, I want to either start my own practice or buy a practice, you're going to have to borrow even more money in order to attain those things. And so for us, I mean, we're old now, we're in our 40s. We were wise enough to be conservative with our spending. And so these debt issues are no longer a problem. But earlier, when we were in our early 30s, mid 30s, mortgage, student loan debt, practice startup debt, that's a lot of money to be buried under, even if you're part of a high income category. And so it's something that you all should think about. Our advice is it doesn't matter if you get the DDS after your name, the MD, the PharmD, whatever your profession ends up being, continue driving your Prius. Oh no, what happened? Sharing is paused. Okay, sorry. Am I back? Am I back? Okay, cool. I think it's because I didn't move the mouse. Our advice is finish school, but continue driving the Honda Civic. Continue living in a small apartment. Eat your ramen noodles for a few more years. Pay off your debts so that you can actually live like a rich person instead of pretending to live like a rich person. And then the other thing is sometimes no matter what you do, patients suffer. Wait, let me pause that now. Sorry about that. Sometimes no matter what you do, patients suffer. You know, the problem with working with teeth is that patients are in pain a lot of the times. And even when you do good work, patients end up still being in pain. And then this video right here, what I want to bring about is posture. Most dentists, by the time they're in their 60s, they start looking like this. Can you all see me? Can you see my face right now? Yeah, okay. They look like this. Ready? That's how they look, you know? Like you walk up to them and they're like, hey, how's it going, right? Because their neck muscles have atrophied over years and years and years of looking down. And so this is something that if you become a dentist, this is something that you're going to want to work against even during your younger years. Do your yoga and your foam rolling and work on your posture so that you're not one of those people, okay? And then this, another bad thing, this could happen.
Holding it, and then I let go, and I moved away because I didn't want to go after it down his throat. I moved away. He sat up, went, I swallowed it.
You know what she's talking about? She was unscrewing a dental implant cover screw, lost her finger grip, and this is a chest x-ray on that individual. I don't know where it is. You doctors probably know, but all we know is it's not in the mouth anymore. Now that is a crappy feeling. I can tell you right now, she didn't sleep well that night. And that could happen because in dentistry, it is a little stressful. You're working inside people's mouth. And I don't care how dexterous you think you are with your fingers and with your hands. Sometimes you make mistakes. In the 15 years that we've been practicing, I've dropped things down people's throat. I've cut their lip. I've cut their tongue. I've cut the little flesh underneath people's tongue. That's just how it goes. And if the longer you practice, the more times that you will at some point make a mistake. And that's something that's hard to fall asleep the night of doing that. All right, let's talk money. Because I know you're not supposed to talk money, but we got to talk about money. All right, I just went on Google. So this is all Google. I just said, how much does the average general dentist make? If a general dentist is an employee for an owner, they make about 167 grand. If they own their own practice, they make about 50,000 more than that, okay? About 216,000. Specialists, the people who end up going to more schooling, more residency programs after dental school, they make more. The average oral surgeon makes about 300 grand a year. The average orthodontist comes close to that. And the average pediatric dentist makes about 250 a year. Now, this was just Google. I don't know if when it said average oral surgeon, I'm sure there's a difference between an oral surgeon who owns their own practice and an oral surgeon who's an employee somewhere. These are just averages. What we can tell you is that we know lots of dentists who make more than this, and we know lots of dentists who make less than this. this is probably a pretty fair average. And so if you are like, boy, I like the idea of being a dentist, I would like to make more than that, that's absolutely accessible. That's something that you absolutely can do. But these are the averages that you can play with a little bit if we're talking about money. All right, here's our info. We both are like really cool about accepting emails. If you have any specific questions that you don't feel comfortable asking in front of this large group, all good, no problem. Our website, if you want to just kind of, what's the word? Troll. If you want to troll our website, go for it. It's all good. So if you want to get any more information from us, that's fine. So do we have time for questions or no?
Maybe we can take like 1 or 2 questions at the most.
All good. Okay, go for it.
So any questions from the audience? Any of the students, any questions for Dr. Ankur Gupta?
I mean, you can unmute yourself, or you can raise your hands virtually, or you can put it in the chat if you have any questions.
I have a question.
Mm-hmm. Hi, Roshan.
So, hi, Ankur, how are you?
Good.
So I have a question. What made you think or want to come into this profession?
Oh, mine is a bad answer. So I went to college to become a history teacher, a high school history teacher. And then I was getting very good grades. So my dad said, hey, you're getting good grades. Do you want to try to get into a professional school? And dentistry just happened to be one of the ones that he suggested. So it's definitely, this is not, for me, it's not a case of me following some childhood passion or anything like that. It was just, my dad made a suggestion, and the one thing that stuck with me though, he said, if you become a dentist, you can teach all you want, but if you become a history teacher, you can't go and do dentistry. You can't do all those other things. And actually that really resonated with me because for those of you who know me, I teach a lot, and being a dentist has allowed me to do that, which has been nice. Nisha, what about you?
I would say the reason I initially, as a high schooler, thought about dentistry is that my dad is a physician, and I knew I wanted to go into healthcare, and I had kind of shadowed in some dental offices and medical offices. And I would say I really liked working with people, and I really liked the idea of being in healthcare, but I didn't love the hours that people were away. And so I thought this was a nice way for me to still be in healthcare and still have the hours that I would like to have. So that's mine.
Anyone else?
How about call schedule, Ankur? Do you have to take any calls?
So the answer is yes, because we own our own practice. If one of our patients breaks a tooth, has a toothache, whatever the case is, they need to be able to get a hold of us. And so all of our patients are able to just call us on our cell phone. And so we're always on call. The good news is that it's infrequent. The number of times, like we've never had to go into our office in the middle of the night. We do go into the office on occasion, on a weekend, but it's usually for about 10 or 15 minutes. We're able to fix something and be on our way. So the answer is yes, we're always on call. But the nice thing is that it's very infrequent to actually have to do anything beyond maybe calling a prescription into a pharmacy.
So thank you, Ankur. I would like to thank Dr. Gupta for his wonderful talk, and Dr. Nisha for wonderful participation. And I hope this was very informative for our youth. And now I would like to introduce Dr. Boris Pakush. He is a veterinarian and owner of West Park Animal Hospital in Cleveland, Ohio. Dr. Pakush earned his Bachelor of Science in 1988 and his Doctor of Veterinary Medicine in 1992, both from the Ohio State University. The focus of his practice is small animal medicine and surgery. And I know him for past many years. He's a wonderful person. So I would like to invite Dr. Pakush to give a talk on about veterinary science.
Hi, Dr. Vikas.
Hello.
I'm here. I want to thank you for this opportunity to speak to everybody about being a veterinarian, which is a profession that I love very much. But I'll have to have a talk with you later because I will never be able to speak as well as Dr. Gupta, and I'm very mad that I have to follow him. It was a great presentation. I actually really enjoyed it. Can you hear me?
Yes, we can hear you.
Oh, good. Very
Yeah,
good. So where I may not have as good a presentation as Dr. Gupta, I'm hoping to illustrate that my profession is better than the dentistry profession. And I say that kiddingly. I kind of want to start just by saying I have a great profession. I hope that me taking the time to talk to everybody this evening will encourage someone to perhaps want to go into the field. It's a great profession, and it is a very diverse profession. I'd like to start with a little overview and say that to be a veterinarian, there are many different pathways you can take in our field. For example, we also, as was certainly just discussed, we're in private practice, which is a majority of our veterinary professionals. But you can also do research. You can be in the military. You can be professors and teachers in the universities. You can actually work in the government. You can actually also be in the food safety fields. Many different avenues for veterinarians, and avenues that you can change once you start the profession. You can go in different directions if you so choose. What also is wonderful about our profession is that it is extremely challenging. And that challenge is what makes it exciting. And so I'm saying that as a very big positive. When I go to work every day, or just as a veterinarian, we go to work every day, and not only do we do dentistry, so I actually have a dental practice myself, by the way, and I wish I had pictures of teeth because I could beat those teeth that Dr. Gupta had. I've had horrible teeth that I've seen in dogs that come through and cats that come through, and lots of dental disease that we treat. So I'm actually a dentist for animals. I'm also a radiologist. Every day I read x-rays. Maybe not as well as Dr. Vikas, but I read x-rays every day. I'm a surgeon, I'm a dermatologist, I'm an ophthalmologist, I do cardiology. I'm also a business owner because I own my own practice. And I do all those things, besides the business owner, I do all those things for many species. Specifically for me though, dogs and cats. But there are veterinarians that also do birds, and they are veterinarians that do pocket pets such as hamsters and rabbits and other things. And so you really can be challenged every single day in your professional life, which is really why I'm encouraging anybody who has that interest to do that. So the next thing I want to kind of talk about, if I can, is the educational process and how kind of things started. And how you get started. So I think everybody's kind of heard that our profession is very competitive to get into. And that is true, but most people don't understand why it's so competitive. And the biggest reason for the competitiveness of our field is that there are very few veterinary colleges in the United States. Specifically, there are 26 veterinary colleges that you can apply to in the United States. I went to the Ohio State University, and this past year, they accepted 160 applicants, students, to enter the college. You can see that with thousands of kids applying to get into veterinary school, it's pretty difficult. There are ways to manipulate the process, and if anybody were to call me, I'd be happy to talk about that. But it is very difficult to get in just because there's so few seats available to get into. Then as far as the pathway beyond the competitiveness of the field, I also want to mention that for myself, My story a little bit is that when I was in high school, I also got real good grades at school, and I liked science. I loved my pets. And the reason I became a veterinarian, when that first moment where I thought, oh my God, I want to be a veterinarian, is taking our dog to the vet with my mother, and he had an ear infection. We went in there, the veterinarian, he looked at my dog for 15 seconds, talked to my mother for a little bit, petted my dog on the head, and charged my mother $45, and we went home. And I thought, oh, that's the greatest job in the world. And so that's kind of how I started thinking about being a veterinarian for myself. And it started that process. And it's important, very, very important for everybody here to realize that to maximize your opportunity to become a veterinarian, because of the competitiveness of the field, decide quickly, decide now, because there are things that you can do, such as volunteering and working for veterinary hospitals, as just one example, so that you can go and start the process of demonstrating your interest in being a veterinarian, as opposed to deciding in the end where your application is not going to have what other applications will have, and you will fall short. So it will be important to decide as quickly as you can. So hopefully this conversation, this talk, will get you there. So similar to being a dentist, and I listened to the discussion just previous to this one, and a very similar process. You finish high school. Once you finish high school, you go to college. When you go to college, you have a general degree in some Bachelor of Science program, but like in dentistry, there are requirements, classes that you have to fulfill in order to get in. You don't have to have a Bachelor of Science. You can be an English major and still apply to vet school as long as you get those specific required classes, just like in dentistry. Once you finish those requirements and potentially your degree as a Bachelor of whatever science, in my case, you do take that test. That MCAT test for us is called VAT, Veterinary Aptitude Test, just like the DAT that the dentist had to take. And it's basically the same thing. You take that test. Once you've taken the test, you've finished your requirements, your required classes, you then will apply to vet school. You will go through an interview process. You will be accepted. And then the veterinary program itself is a 4-year program. To talk a little bit about that program, the first 3 years of your veterinary education, your first 3 years are all classroom. You sit in the class. They are going to teach you anatomy, physiology, dermatology, endocrinology, everything that you can think of for dogs, cats, horses, pigs, sheep, goats, everything. Even things you have no interest in. And you're sitting there and you have to memorize this stuff. And then eventually you're going to do whatever you want to do with all that information when you're graduated, when you're done. Your 4th year of veterinary college, your 4th year is kind of like our internship. So your 4th year, you are actually at the college, and they are a veterinary hospital. They take care of dogs, cats, horses, cows, pigs, sheep as a business. And so these patients are brought to the college for you to learn under the supervision of your professors, and who are obviously veterinarians. And so when you finish that 4th year, you then will sit for your board exams. Once your board exams are complete, you are now a veterinarian, and you are allowed to move forward and practice on your own in anything you want to do in the veterinary field. Now, obviously there's some limitations. I'll talk about that later. If in fact anybody at that point would like to continue with their education, and many do, you can. So let me start over. You had 4 years of undergrad, of your bachelor degree. You have 4 years of veterinary school, and you can then go out and be a veterinarian. That's a general practitioner. That's what I am. I'm a general practitioner. I stopped school after 8 years. If I wanted to continue school, I would enter the specialty programs, the residencies, as we called it. These residency programs are traditionally held through the universities, and these programs are very difficult to get into. They only accept the top of the classes of my classes. The top students only get into the residencies. And the residency programs are in all the different fields that are in medicine. So we have specialties and residencies in surgery, in dermatology, internal medicine, oncology, ophthalmology, anesthesiology, epidemiology, every single thing in the human field. We have the exact same specialties in our field. And those are 4-year residency programs. Those residents have already become veterinarians, general practitioners, because they passed the board exam. They will be our teachers in that 4th year of my, when I was in my 4th year of veterinary college, the residents are our teachers along with the professors. And then when those residents have finished their 4 years of studying just their subject, although in all the different species, so you can't be a cardiologist of just dogs, you got to be a cardiologist of dogs, cats, horses, cows, sheep, and when you're done with that, you sit for another board exam, a certification exam of your specialty. At that point, you're a specialist, and you come out and you practice a little differently than I do. I'm considered a general practitioner. Specialists come out and they practice in specialty practices primarily, although they can practice on their own if they have the right kind of specialty. But they practice together, and they have these specialty practices throughout the United States. Most big cities will have 3 or 4 practices that are full of specialists where they receive cases from us. And I'll get into that later in my discussion. But that basically is the educational process of veterinarians. So next on my list, I do want to go over compensation because that will make this more interesting. Because everybody always wants to know how much they can make. Our profession, when I started school, when I became a veterinarian, I didn't make any money. Not a lucrative thing to get into at all. Since I've become a veterinarian, I became a veterinarian in 1992. So I've been working now for a lot of years, almost 30. In that our salaries have really risen to where they should be for our level of professionalism that we have. And so I know that in my own practice, when I hire a veterinarian to work for me, that veterinarian coming out of school will make $100,000 easily. Some more, not many less, but they will earn about $100,000. My experienced associates that work for me, those that have been there for 10 or 15 years, they're making $200,000 and a little bit more. Just depending on how many, and really what it depends on is your level of desire to accept caseload. The more caseload you're willing to accept, the more you will make. And some of you will want a big caseload and some of you want a lesser caseload, and that's okay. You will make as much as you're willing to take on, and it's not as easy as it sounds. Those specialists that come out of school, those specialists, when they finish that extra 4 years, they went to college for 12 years, those specialists are starting at about $160,000. And so, and the different specialties will have different amounts also, just to say that. But as a general rule, about 160. They will max themselves out at, and not as practice owners, but just as working as a specialist in a big practice, they will make $300,000 to $350,000 per year, and a tremendous amount of money once they've kind of gotten into their specialty and are working, after 6 or 7 years of experience. I also then want to say that out of the other types of professions we have, You know, we have those veterinary professors. Those are those who taught me how to be a veterinarian, and all those classes and lectures I sat in. The teachers in our profession, they're making about $100,000 to $150,000 a year. But there are also veterinarians that work as just as dentists. Those bases, those military bases all around the world, they have dentists working at them to take care of the teeth of the servicemen. Those servicemen also have pets, so there are veterinarians on those bases also taking care of the pets. And I don't really know what they would make, but I imagine it's an officer salary or whatever that might be. And it might be an exciting profession because you travel the world and you live all over the place. But there are also veterinarians that work at zoos. There are veterinarians that work in food safety. There are veterinarians that work in government entities, the Centers of Disease Control, for example, lots of veterinarians. All these veterinarians are making in that level, are making about the $100,000 range. And it's still a very good profession and a great thing to do and very exciting. So having said all that, you all know what I make now, maybe not, but you know what we make financially. You kind of know what the educational process is that is going to get you to where you want to be. I kind of wanted to take a moment to just let all of you know how I got to where I'm at right now, so that you can get a vision of what you're capable of. I just wanted to illustrate it, just to kind of tell you what I did. So I like I said, I grew up, I did well, I liked pets. I thought a veterinarian was fantastic. I worked for a veterinarian. I went to college. I got a bachelor's degree. And at that point, I decided, you know what, I'm going to go to vet school for sure. I finished. I went to vet school. I graduated. I thought it was fantastic. I enjoyed my education. It was very, very enlightening. And I came out and I worked as a general practitioner for a veterinarian. Because a lot of us, even though I could have just started on my own, we do still want extra training. So we can work for someone else as an associate doctor so that we can learn a little bit, gain some confidence, gain some experience. Then if we want, we can decide to go out on our own to create a practice in our own vision. And to, as Dr. Gupta said, we want to pick the people that work for us. We want to pick what our buildings look like, and we want to make decisions that we feel are right for our clients and our patients. And so I did that. I was a veterinarian as an associate for several years. After 2 or 3 years, I forget exactly how much, I decided I'm going to buy my own practice. I found one for sale in Cleveland. A nice old guy who was ready to retire. He worked there himself with 4 other people for about 40 years, and he was done. I bought his practice in 1996, and I worked hard for a few years. I didn't have a family at that point, so I was able to work a lot of hours. I put a lot of time and effort, and I started hiring people. We started to grow, and that little practice I bought 20 some years ago, however long ago that was, a long time ago, that practice has now grown to where instead of me being the only vet there, I'm one of 24 veterinarians that work there. I have 135 employees. We have an enormous practice. We're building a new building this next year, starting construction. We have a 7,000 square foot building now. We're going to build a 35,000 square foot building. And so my potential is unlimited based on how much I want to put into the practice. And your potential will also be unlimited. Whether you go choose dentistry or whether you choose another profession, if you go, and my emphasis is, and take nothing more from this than this statement, and that is, be your own boss, own your own practice, be in control of your own destiny. Very important, in my opinion, just as was emphasized, Dr. Gupta, because you know what, you'll be so much more happier, I think. And no offense, Dr. Vikas, that you work for the clinic. Sorry. Irregardless, I would emphasize that because I think it's really amazing. So now what I want to do real quick, if I can, I just want to, and I'm not sure how long I'm going, I hope I'm not going too long. What I want to now say is, I want to just go through a day. What do I do when I go to work every day that makes me want to go to work every day, that makes it interesting? And my day, every day that I go there, and I want to mention that I also, my entire office, every doctor and every staff member, we work 4 days a week. And for me, that's 4 days of being a veterinarian. The other 3 days are for business stuff. But my doctors work 4 days a week. My staff works 4 days a week. So everybody has a 3 day, 3 days each week to recuperate, which I think is very important. So basically what my day is, and I'm a general practitioner again, and a vast majority of veterinarians are general practitioners. I work in small animals. I work on dogs and cats primarily. Some small animal practitioners will do pocket pets, birds, and other things. There are also large animal veterinarians that work on horses, cows, sheep, goats, all that stuff. Interestingly enough, one of the tricks to getting into vet school is to tell them you want to work on cows, because nobody does anymore. And if you go there and say you do, then you're in. So that's the secret. And you have to study everything. So once you come out of school, you can do everything you want. So it doesn't matter. Irregardless. So basically my day, every day that I work, I have 3 hours scheduled to do surgeries. So if I do 3 hours of surgical procedures every day, and I do probably 5 to 6 hours of appointments. In my appointments, just to start there, my appointments vary. I have dogs that just come in for wellness visits, dogs and cats that come in for wellness visits. They're due for vaccinations. Some might have ear infections. Some might come with skin problems, eye problems, dentistry problems, bad teeth, odors. It varies in all realms of everything. I even do behavioral problems. So to some degree, I can say I'm a psychiatrist. But in general, I see a vast array of appointments. And then surgical procedures, I choose to do what surgical procedures I've found that I'm good at. So you should always only do what you can get good at, which you're competent in and where you have confidence. So I kind of do mostly soft tissue procedures. I have partners and associates that prefer orthopedics. And so they focus on those things. I focus on soft tissue things. And we work well together that way so we can share our caseload. But I go each day and I do surgery every day that I'm at work, and I do appointments every day that I'm at work. And so that makes my day very interesting. And I will say that all the veterinarians in my practice pretty much have the same schedule. If you were a specialist, so I'm a general practitioner. If you're a specialist, again, these are veterinarians that finish their general practice degree like mine. They're veterinarians, they go back, they do their residency, and then they enter the specialty program. Those specialists do not do wellness visits. They don't do vaccines either. If they're dermatologists, they don't do diarrhea. If they are radiologists, they don't even see patients. They sit at home and read the x-rays. And so it's the same. Ophthalmologist, if you're an ophthalmologist, you will only do eyes. But if you become a veterinary ophthalmologist, you can do cataract surgery on dogs. And I have had people that have taken their dogs for cataract surgery. I have clients that have taken their dogs for chemotherapy, radiation, MRIs, CAT scans, hip replacements. They're starting to do elbow replacements in dogs. People will pay anything to improve the quality of the life of their pet. It's a family member. And so your ability to help someone to save the lives of their kids to some degree is there, and that's where it's very rewarding. And we have all the no different than you know, the reward, having the reward of making someone's teeth look better every day that I'm there, someone thanks me. So it's a great profession. I do really hope someone really loves it and wants to do it. You can't go wrong, I promise you. The other fields of the veterinary, and just kind of in conclusion, the other fields such as zoo veterinarians in the military, teaching, university, they're kind of self-explanatory. There's pros and cons to all of them. And like Dr. Gupta said, I don't practice in those areas, so I don't know what they all are, but there are parts to those that can be very rewarding. And I'm sure there are also challenges in all those things. And wherever your interests lie, you can choose any field in our profession and change it if you're not happy where you're at. So hopefully, I'm hoping that in the information I've given everybody, I hope somewhere someone has interest in becoming a veterinarian, because I think it's a great profession. Thank you.
Thank you, Dr. Boris, for a wonderful talk. And you gave a really good comprehensive outline about how to become a veterinarian. And I liked your biggest message, that is a younger generation should try to be like their own boss. And from Dr. Gupta's talk and from your talk,
Yes.
whatever profession they go in, they should think about entrepreneurship, and
Yes.
they should think about having their own practice. So now we have like only a couple of minutes. Any questions from any students?
Hi, Dr. Pakush. Thank you so much for speaking. You had a great talk. I had a quick question for you. So I have a twin sister who's applying to vet school right now. And I was just wondering if you had, I know you said your tip was to say that you want to work on cows, but do you have any other tips for her as she's doing a lot of Zoom interviews, and it's a little different this year, but do you have any tips for her while she's applying?
So that's, can you hear me?
Yes.
Okay, good. Okay, so that's wonderful. I'm very happy for her. And I hope she gets in. And I will say that in the application process, it is basically what they do is they have a 100-point scoring system. So they allot a certain amount of points to your GPA. They allot a certain amount of points to your veterinary aptitude test. And there's so many points that go to your interview. And then there are so many points that go to your volunteering. And really what it kind of comes down to is you do kind of have to try to gain as many points at 100 out of 100 to get in. And when I say the part about getting in at this stage is tough, and I kind of joke about the cow thing, obviously, but it's kind of true. And you know, those would be those bonus points where if you're even in tie with somebody, that kind of might put you up above somebody. But the things that get you better is to get that application better would be those volunteering things that you would have had, she would have had to have done now. Like if you're in high school and college in those early stages, if you do those things, they even now promote research. So they want students to go ahead and do some sort of research where they can actually publish something somewhere before they even enter vet school. So it's crazy stuff. But doing those things gets you in. So I don't have any great advice, but I wish her luck.
Thank you.
No problem. If she needs a job, let me know.
Any other questions from any other students? So in that case, I would like to conclude by thanking once again to Dr. Gupta and Dr. Pakush for their wonderful talks. It was very informative and hope it was very helpful for our youth. And I would like to thank Dr. Raina for coming up with this idea. And thanks to all the participants for joining, because without the participants, this meeting won't be a success. So please remember, next Sunday at the same time, 7 to 8 p.m., we have one more web conference that is going to be on leadership and entrepreneurship. So it is going to be a talk by Dr. Rita Singh on leadership and a panel discussion from 2 enterprising physicians on entrepreneurship. It is going to be on next Sunday from 7 to 8 p.m. So with that, I would like to conclude. Thank you.
Thank you.